Hello friends, welcome back to my channel. I am Dr. Saurabh, and today in this video we are going to discuss on a very important topic, that is by comparing the bone age, height age and chronological age, how to come to the diagnosis, whether it is hypopituitarism or whether it is hypothyroidism or it is familial short stature or constitutional short stature. So first of all, let us start from the basic thing. So for example, just now in our ward there was one patient. She was 5.5 years. The age of that child was 5.5 years. So that is called as the chronological age. So the chronological age is 5.5 years. Now for bone age estimation, we use the various X-rays for that, and commonly used X-ray is the X-ray left wrist. On the basis of the scaphoid bones, we can estimate the age. Also, elbow X-rays are used in some elder patients. So this is for the bone age. And the third one is the height age. So how to calculate the height age? So for height age, you have to take the height of the children. For example, the height of that child was around 95 centimeters. So we have plotted this height of 95 centimeters, and it was less than third centile. And also the weight of the child was 12.6 for 5.5 years child. So both the height and weight was less than third centile. So we have plotted this height which was less than third centile. Then we have taken the 50th centile of that height. So by taking the perpendicular from the 50th centile on the age on the x-axis, it was 3 years. So the actual age of the child was 5.5 years, which was the chronological age. The height age of the child, by plotting the graph on the 50th centile, was 3 years, and by the X-ray of this left wrist, the bone age was 2 years. So let us have one sequence, that is BHC, that is bone age, height age and chronological age. So the bone age was 2 years, height age was 3 years, and the chronological age was actually 5.5 years. So bone age was less than, height age was less than chronological age. So this is the typical presentation of hypopituitarism. And also we have done the MRI for that patient, and that MRI was also suggestive of hypopituitarism. The sella turcica was empty there. So our diagnosis was accurate, that was hypopituitarism. So let us see some few other conditions, and on the basis of that, by comparing these three parameters, how can we come to the diagnosis. So if the bone age is equal to chronological age, which is more than the height age, then it is seen in the familial short stature. Whereas in constitutional short stature, the bone age will be equal to height age, which will be less than the chronological age. So this is typically seen in constitutional short stature. Whereas in hypothyroidism, bone age will be equal to height age. So this is one simple method. On the basis of bone age, height age and chronological age, we can determine whether the child is having hypopituitarism, hypothyroidism, constitutional short stature or familial short stature. So this is one of the very important topic. I hope this video was useful. Do subscribe to my channel for more such updates. Thank you.